Today, I, Dr. Tarun will be speaking about lymphadenopathy and its homeopathic management. So, quite often a question is asked about cervical lymphadenopathy and its management, and what is cervical lymphadenopathy, signs and symptoms, so on and so forth. So, in brief, in short, I'm trying to explain in first what is lymphatic systems, right? And then I'll talk about what is cervical lymphadenopathy, the signs, symptoms, the investigations, and management. Management, I'll see to it that I discuss it at a late in the next video. So for now, this much. Understand it. If any doubts, do let me know. So here we begin. Before understanding what is cervical lymphadenopathy, आपको शायद पता है lymphatic system क्या है? याद है? पता है? Okay. चलो, lymphatic system is like just another vascular system. मतलब तुम्हारे arteries and veins की तरह you have lymphatic system which actually will carry up all the impurities from your body, from every part, and take it back to your heart for further circulation, right? It will take everything from your intestines, वगैरह वगैरह. But through the channels, when it is flowing through the lymphatic vessels, in between there are some nodes, जिसे मैं कहती हूँ पुलिस स्टेशंस की तरह, right? So these nodes, जहाँ पे everything is basically collected, are called lymph nodes. Okay, all the impurities are collected out over here. And say by any chance there is a bacterial invasion which is happening out over there, or whatever thing is there happening, it gets affected. So जब ये affect हो जाता है, जब ये swollen up हो जाता है, उसे हम कहते हैं lymphadenitis या lymphadenopathy. मतलब नॉर्मली आप कहीं पे आपके लिम्फ नोड पाल्पीट कर सकते हो क्या? नहीं. आपके है ना लिम्फ नोड्स यहाँ पे, दिस एरिया, सर्वाइकल एरिया, राइट? So we have everywhere your lymph nodes. In the cervical area they are called cervical lymph nodes. In the axillary area they are called axillary lymph nodes. In the inguinal area they are called inguinal lymph nodes. ठीक है? So you have lymph nodes everywhere. They are like checkpost. They'll collect every impurities out over there. So but कभी कभार ये ना अफेक्ट हो जाते हैं, और अफेक्ट होने की कॉजेस क्या क्या है ये जानना बहुत जरूरी है. अभी अफेक्ट होने के लिए कोई सॉलिड कॉज होना चाहिए, बिकॉज अदरवाइज दे डोंट गेट अफेक्टेड, isn't it? So इनके अफेक्ट होने के कॉजेस क्या क्या रहेंगे? इन्फ्लेमेटरी फर्स्ट, सेकेंड वुड बी न्यूओप्लास्टिक, राइट? Then would be your leukemias. Leukemias also some say that it is a neoplasia only. However, consider it thoda different. It is leukemia only. I would say lymphatic leukemia. And then you have some autoimmune disorders, and then generalized causes. So we talk about what are the inflammatory causes. Now what comes under inflammatory causes? This is acute lymphadenitis, your chronic lymphadenitis, and your granulomatous lymphadenitis. ये तीन चीजें याद रखना. This is the cause of inflammatory. मतलब inflammatory lymph node enlarge होने की chances अगर है, तो वो उसके कारण क्या रहेगा? Acute lymphadenitis that will cause, or it might just cause chronic lymphadenitis. So chronic lymphadenitis can be because of inflammation also, or it can be because of granulomatous infection. The neoplastic would be benign or malignant. ठीक है? Then you have leukemia, then you have autoimmune disorders, and you have generalized disorders. Now what are generalized disorders? Now अगर आपने ऊपर देखा है inflammatory में, तो वहाँ पे मैंने granulomatous lymphadenitis भी कहा है. Similarly यहाँ पे generalized मतलब any random cause, any random. So this could be tuberculosis, this could be syphilitic syndrome, syphilis syndrome. It could be infectious mononucleosis or sarcoidosis or brucellosis, toxoplasmosis, Hodgkin's disease, lymphosarcoma, and lymphatic leukemia. So these are multiple causes which will come under generalized. So basically causes of lymphadenopathy क्या क्या आ जाते हैं? Inflammatory आ जाते हैं, malignant आ जाते हैं, neoplastic आ जाते हैं, lymphatic leukemia आता है, and then you have generalized causes. ठीक है? अभी ये एनलार्ज हो गए हैं. अगर ये इन्फ्लेमेटरी के कॉज है या ल्यूकेमिया की कॉज है ना, आपको एक अंदाजा लगाना है इसके सिम्टम्स क्या क्या रहेंगे. सो अगर मैं बता रही हूँ कि ये यहाँ पे लिम्फेडेनोपैथी है, यहाँ पे एनलार्जमेंट है. लिम्फेडेनोपैथी इज enlargement of your lymph node. So this can be in your inguinal area, this could be in your axillary area, this could be in your cervical area. ठीक है? So when they are enlarging, जैसे मैंने पहले कहा, they are like check post. They are collecting all the bacteria, all the toxins that is circulating in your body and preventing फर्दर प्रोग्रेस, सही बात है। सो अगर ये फर्दर प्रोग्रेस प्रिवेंट कर रहा है तो उसका enlargement is also going to cause some symptoms. So what are these symptoms going to be? First, there will be lump located under your jaw, अगर ये cervical है तो, ठीक है, यहाँ पे हम specifying about cervical, और ऑन द साइड्स ऑफ द नेक, और अगर वो कहीं और का है तो एक्सिलरी, या अगर इंग्वाइनल का है तो इंग्वाइनल, या you might see sometimes in some abdominal cases mesenteric lymph nodes also get enlarged, ठीक है। This you do not see on examination, this you will see on sonography, ठीक है। Then what you will see is coinciding lumps में also be there कहीं और उसके आगे पीछे ऊपर नीचे वाले एरियाज में। सो अगर सर्वाइकल में है तो आपको आर्मपिट में भी कुछ मिलेगा, आपको चेस्ट एरिया में या स्टमक में भी कुछ मिल सकता है। Then whenever it is inflammatory, you will also encounter pain, you will also encounter tenderness, and the affected lymph node or lymphatics is getting affected. The lymphatic channel over there will be affected, ठीक है। Skin around in cases of inflammation will turn red, will be warm. What else will you experience? Fever, you will have sore throat. कई बार आपने नोटिस किया है गले में खराश या टॉन्सिल्स होने के बाद डॉक्टर विल पाल्पेट ओवर हियर, or even you must have palpated out over here, submental, submandibular, ठीक है। So this is sore throat also is one of the symptom, fever is also one of the symptom, congestion or khasi या irritation predominantly of cervical area, will not be in inguinal, ठीक है। Then you will have some rashes, you will have some loss of appetite also happening because of that, or some muscle aches and pains if it is because of some infection again happening, and headaches, earaches अगर यहाँ बाजू में वगैरह है, feeling tired, and if it is of a chronic duration, then one may encounter even weight loss. You may also encounter weight loss in case if this is a lymphadenopathy enlargement happening because of tuberculosis or any chronic causes. बट अभी ये ट्यूबरकुलोसिस है, ये देख के तो पता नहीं चलने वाला है, सही बात है, या वॉट एवर इज द डायग्नोसिस देख के पता नहीं चलने वाला है किस वजह से है, तो आपको इन्वेस्टिगेट करना जरूरी बन जाता है, राइट। सो व्हाट आर द इन्वेस्टिगेशंस दैट यू विल बी डूइंग इन दिस केस? First, we'll start with routine. Routine investigations will be blood tests. What are they? CBC, your ESR, your LFT. Why would you do LFT? Liver function test. अगर patient बुखार बोल रहा है, weight loss बोल रहा है, appetite loss बोल रहा है, differential diagnosis of appetite loss में hepatitis भी आता है. To rule out that, you will do LFT. कई बार आपको USG भी करनी पड़ती है. Why? Because again loss of appetite हुआ है, fever हुआ है, you need to rule out some other causes, so आप USG भी करा लेते हो. Then you will do serum create, you will get a chest x-ray done, which is mandatory, the first investigation that you will do. Serum electrolyte अगर वो बहुत ज़्यादा weakness कह रहा है, and blood smears अगर आपको बहुत lymphatic channels या वहाँ पे flare दिख रहा है, swelling, edema दिख रहा है बहुत ज़्यादा, तो you will have to get it done, सही बात है, ठीक है। Then what are the other special investigations? The special investigations when you're suspecting कि sure शायद ये हो ही सकता है, आपको क्या रूल आउट करना है? फाइलेरियासिस रूल आउट करना है, आपको ट्यूबरकुलोसिस रूल आउट करना है, आपको मैलिग्नेंसीज रूल आउट करना है, हॉजकिंस वगैरह, आपको ल्यूकेमिया रूल आउट करना है, तो आपको फर्स्ट एंड फोरमोस्ट आपको एस्पिरेशन करना पड़ेगा, FNAC, या फिर आपको बायोप्सी करनी पड़ेगी, या आपको मांटूस टेस्ट करनी पड़ेगी टू रूल आउट इफ इट इज TB, yeah, you'll have to do further radiological examination which could include even your CT scans also, or you will have to do a laparotomy अगर abdomen में है to figure out what exactly is the causes, and then Gordon's biological test which is specific for Hodgkin's disease also is done. So these are some of the investigations that you will be doing to rule out ये किस किस्म का या what is the cause, definitive cause of this lymphadenopathy. If it is cervical lymphadenopathy, if it is inguinal, then inguinal lymphadenopathy. In any case, you will be doing these investigations. Now comes the scope. Do you think you can manage lymphatic enlargement, lymph node enlargement with homeopathy? Definitely you can manage. You can manage. The scope is good. It is functional again. It is reversible. And if the general condition again of the patient is fairly good enough also भी you can manage. The scope is good, excellent. ठीक है? In most of the cases of lymphadenopathy, they can be managed. Now, what are the commonly encountered, asked homeopathic or commonly prescribed homeopathic remedies? I will speak about this in the next lecture. I hope अभी तक आपको ये समझा है आई होप समझा है, या इसमें नहीं कुछ समझा है तो प्लीज मुझे बताना क्या नहीं समझा, एलैबोरेट ऑन दैट। या आपका अगर मैसेज नहीं आता है, कुछ कुछ समझ में नहीं आता है मुझे आपके थ्रू, मतलब, बट एनी विच वेज आई विल बी पुटिंग अहेड द थेरेप्स ऑफ योर लिम्फेटिक या लिम्फ नोड इनलार्जमेंट, ग्लैंडुलर ड्रग्स। एक हिंट दे देती हूँ, homeopathic drugs which are used for lymph node enlargement will always be those drugs which have scrofulous diathesis, which have glandular affinity. So think about those drugs. They are very common. कौन से drugs रहेंगे मैं hint नहीं दूंगी, मैं next वीडियो में वो सब डाल दूंगी, ठीक है? Keep watching. I hope this topic is somewhat clear to you.